Pop back here onto the mat. We're going to start off with a sleeper stretch. If you want a pillow for your head, go grab it. And also, if you have those yoga blocks, you're going to need two, or just like a couple towels to roll up. We're just going to need to support our arm here in a second. So I'm going to throw down the mic. I'm going to grab a pillow for my head, and then we'll get going. Okay, so starting off with the sleeper stretch. Now, the sleeper stretch is going to bring you into internal rotation of your shoulder, where internal rotation is when the middle of that bone rotates towards the midline of your body. And we can do that with our leg too, but today we're going over neck and shoulder. So internal rotation of your body is important for throwing. We do need to own it if we're typing all day. So we sit like this all day passively. We don't have good control of this range of motion often, though, when we need it to come into internal rotation away from our body. And so that's where we're going to be getting with our sleeper stretch, where you're on your side, your arm is extended out away from you, your torso is upright towards the ceiling. I'm not leaning back. If you lean forward, you're going to scream at me. You're going to say, Mike, what the heck are you doing? All I want is a nice upright torso. You're then going to bring your hand up. So my elbow is still at shoulder level. I'm going to take my top hand, and I'm going to push down. I'm relaxing my head. So I hope you get real comfortable with this position. You should be feeling a stretch on the cap of your bottom shoulder. So kind of behind it, kind of above it, right on the top of the shoulder. And we're just here 60 seconds. I have a different watch on today, so I can't really tell what time it is from here. It's a shame. We'll do our best guess. So we're just passively stretching out the external rotators of our shoulder. Two of the guys that make up our rotator cuff. It's half of our rotator cuff. So we got our teres minor and our and our infraspinatus. Infraspinatus, teres minor. Those guys externally rotate our shoulder, but when they get really tight or stressed, they can prevent the amount of internal rotation we have ownership of. And so you're gonna make a fist with that bottom hand. You'll see I took that bottom hand, I made a fist. And what's going to happen is I'm going to take my top hand off, and I want to see if I can't keep my bottom arm right where it is. So if I take my arm off and you see my hand go up like this, that means that I didn't have ownership. I wasn't able to control this new range of motion. That's the whole point of this next exercise. We're doing end range isometrics and internal rotation. So I'm going to push down. I'm going to tighten my belly. I'm going to use my chest, my shoulders, but I need to be able to breathe. So I'm going to push, and then I'm going to take that hand away and try to hold this range of motion as good as I can for 3 seconds. We're going to do 5 reps. Ready? 1, 2, 3. 1, 2, 3. And then I relax. And I push, and I hold. 1, 2, 3. We're working on trying to gain control of that end range of internal rotation. Ready? 1, 2, 3. And I'm starting to lose a little bit. And I know that my right shoulder, the one I have down, has really been bothering me lately, so this could definitely use some improvement. And we got 1 more to go. And I'm not trying to crank my arm to the ground, I'm just trying to get a nice little stretch in the back of my shoulder. Here we go. Okay, and those are the 5 reps on that side. Whew, so that was my right shoulder, but now it's time for the left. We've got to go through those same 2 things. We're going to sleeper stretch first, trying to get a little bit more range of motion in that shoulder, and then holding it at that end range with some isometrics. And so we're pushing down. Let's see here. Can I get that minute instead of like 8 minutes that I normally give you guys? And so just really passively holding this in place. Torso's upright towards the ceiling. Not leaning back, that's going to reduce the amount of stretch I feel, and I'm not leaning way forward because that's going to put a lot of pressure on that posterior rotator cuff. And so I'm just hanging out here for 60 seconds. That's the minimum that I'm going to stretch any muscle passively. Passive stretching does hold a place in trying to gain more range of motion. After injuries, after surgeries, maybe we've been muscle guarding, maybe we've been holding certain areas of our body really tensely. We need to lengthen them. Passive stretching has been shown to actually decrease muscle tone, or actually relax the muscle so we can get more range of motion out of it. And then we can use it with these end range isometrics. Let's see where we're at here.
Okay, we're just about there. So I'm gonna make that fist on my left arm. I'm gonna push and then take away. 1, 2, 3, and back on. Tighten that trunk, push down and hold. 1, 2, 3. Great. We got 3 more. Push and take away. 1, 2, 3. You'll see I'm straightening pretty hard. Push and 1, 2, 3. We got 1 more left, and then we're moving on to isometrics for your neck. I can almost guarantee you've never done this next exercise. I had to dig deep in my toolbox for it. We got 1 more on our shoulder. Oh, that was a bad one. Let me start. Hold there. Tighten and 1, 2, 3. All right.
Okay. So we've got isometrics for the shoulder out of the way. In that range of motion, maybe you're feeling really stressed, but maybe you're feeling a little bit limber. So I said that you're not going to know this next exercise, but you'll definitely know this one. I skipped ahead on my little list on the board here. We're actually going to go to open books to open our chest and stretch our pec and our shoulder a little bit. And then we're going to use these yoga blocks or towels for some end range isometrics of external rotation. And so you can actually stay on your side. A little premature there. You're going to bring your knees up towards your chest. You're going to hold them down with your opposite hand. The bottom hand goes on top of the top leg. Your opposite hand, the top hand, comes up and you go over, stretching out your pec and your chest, reaching kind of up to head level. You don't want to drop your hand down here. You're not going to get very much stretch in your pec minor with this if you go there. We're going to make 10 reps where you're reaching kind of up at a diagonal. And you're going to breathe out as you go. So we're stretching your pec, but we're also mobilizing your thoracic spine. So it's crucial to breathe out, exchange air, not hold your breath, and make your lungs tense or fill up with air. We're going to go for 4 more. Nice and gentle. The cool thing about open books is you can only go as far as you can go, but you want to see, can you push it a little further with each rep? Maybe week by week or day by day, you see that you get a little bit more out of it. So we're going to come back to the other side. But we're going over isometrics. So I have my right arm moving, so I'm going over these end range isometrics with my right arm first. Now to do this, I need 2 yoga blocks or a bunch of towels to kind of stack up and keep my shoulder in line with my body. You'll see what I mean here in a second. So I'm going to be on my belly. And I'm going to have my elbow and my shoulder at 90 degrees. So I'm laying on the ground like this. And from the side, I'm in line with my body. I don't want to be here, and that's what I need the towels and the yoga blocks for. And I don't want to be way back here. That's going to make things pinch a little bit in the back of my shoulder. I just want to be in line with my body. And so if I'm laying down, I'm on my yoga blocks, I'm going to be pulling up with my hand and holding it. So we just went over trying to get a little bit more external rotation out of our shoulder. Now we're going to hold that isometric. 5 reps, 3 seconds apiece. And so you've got your yoga blocks supporting your arm and your forearm. I've got my head on my fist just to keep my neck in a great position. And then I'm going to be lifting my forearm off the yoga blocks and holding for 1, 2, 3 seconds. Very good. 1, 2, 3. Okay, here we go. That was my Count Chocula impersonation. So we're making a fist. Lifting as far as you can and holding. And then relaxing. Fist. We got 3 more to go. Okay, and I'm like a broken record. Rinse and repeat. Now we go to the other side. We've got to do our open books to get that external rotation and thoracic spine mobility going. So we're going here. Bottom arm covers the top leg to prevent my hips from rotating. Reaching up at an angle. You'll see I'm reaching up here, not down here. Mobilizing the thoracic spine. Breathing as I go back. Blocking my hips from moving, so I get all that rotation in my thoracic spine. If I were to be stuck here and not hold my legs down, I could still fake it by lifting my legs. But I gotta hold down. I got 3 more to go before we do some isometrics for end range external rotation. And 1 more to go. Alrighty. Alright, so we did these guys on the right. It's time to do them on the left. You set up your yoga blocks to support your arm. You're gonna support yourself in that 90-degree bend at your elbow. So we got 1 block on your upper arm and 1 block on my forearm, and then I'm pulling back. So we're gonna do 3-second holds, 5 reps, and then we're moving on to that weird one I told you about a second ago. I got my forehead supported so I'm not flexed, I'm not extended, and I keep my neck in good alignment. Pull back and hold. Maybe some of you are feeling the back of your shoulder cramping up, and those are those 2 external rotators that I mentioned before, your teres minor and your infraspinatus. They're really small. They're like the size of your pointer and middle finger combined, but they produce tons of external rotation and have to support your arm with a ton of the movements that you do. So sometimes they need a little bit of love. Last one. All right. And the shoulders are feeling good. We've done internal rotation, we've done external rotation. Move your shoulders around. How do they feel? They should feel pretty loose, pretty good. Now some people are going to say, oh, my shoulders are cracking with those. That's always okay by me as long as it's not hurting while it's cracking. If it's hurting while it's cracking, go see your local medical professional. Things are opening up again. You can get in and see your physical therapist or your physician for a nice little evaluation that can kind of tell you what's making that noise and that pain. But we're going to move on. We're going to be doing an exercise that I haven't done this one with a patient in years, but I think a lot of people might enjoy it because we're going to start incorporating our hip, our butt muscle, our obliques, our abs, and our neck. We're working a big system. We're not just focusing on pushing our head around for these isometrics. We're going to kind of combine a bunch of stuff. And what we're doing is we're going to be pushing on our head with one hand, and you're going to be kicking back with these opposite legs. So it's very similar to a bird dog being down here, but going there, where you reach back with one arm and the opposite leg, or reach forward with one arm and back with the opposite leg. Except this forward arm is going to be pushing on your head, and you're going to feel your obliques actually start to work a little bit more than you would with a bird dog. So I'll show you one, then you hop on. We're going to make 5 reps on each side. Go at your pace, but you want to hold for about 2 seconds per rep. And so if I do this side, I go back with my leg, so then my opposite arm goes to the side of my head, and now I'm pushing. 1, 2. And I'm going to switch. 1, 2. From the front, it looks like this. Reach back. 1, 2. And kick back. 1, 2. All right, so I got 3 more reps to go. Firing all those neck muscles to prevent my head from going down. The back of my neck has to fire. To keep my neck in alignment, the front of my neck actually has to fire. And to prevent side bending, the side of my neck has to fire. So we're working actually all those muscles of your neck, and your trunk, and your butt, and your shoulder, just with this one weird exercise. Let me tell you, now that I've remembered that this one exists, I'm starting to think in my head, I have a couple patients that might need this. I think I got one more. I don't know. I'm a physical therapist. I can't count well. One more. Here we go. All right, so we're working on mid-range isometrics for our neck and our trunk, but we were incorporating the rest of our body. So it's a little bit more challenging on an isometric versus just singling out a specific side of your body or a specific area of your neck. Now, we have 2 exercises that are going to mobilize your shoulders and your thoracic spine because we're going to be going into the end range of rotation rotation of our thoracic spines and holding it there. And eventually it's going to fire your obliques like crazy, maybe even your lats. They're going to have to work really hard in a minute here, so we want to make sure that your thoracic spine is ready to rotate. You're saying, hey, thoracic spine, body, get ready for what we're about to do. So to do this, we're going to be in quadruped. So for those of you whose wrist might be a little bit sore from that last one, which you could have done on your forearms, this one, I would say it's going to be tougher to do on your forearms. You might want to try to modify this maybe on a table, maybe on the side of the couch, something like that. And what you're going to be doing is you're going to be on your hands and knees. You're going to be wider than your body with your hands. And I'm going to take my right shoulder and I'm going to try to point it to the floor. So I'm actually rotating. I'm keeping the non-moving arm straight. Okay, I'm not bending this, keeping it straight. And I'm rotating my spine. I'm going to the other side. And you'll feel a stretch in the front of your shoulder. And we're going to be rotating our thoracic spine, maybe getting a little bit of that rotational mobility that we're going to capitalize on in a little bit here. So we're making just 5 to each side. Wider than your body. Tilt that shoulder down to the floor. Breathe, get a little bit more rotation in your thoracic spine. I got 2 more left for me. Maybe you're done by now, maybe you're just grabbing a sip of water. I feel my thoracic spine moving like crazy. Okay, so for those of you who have, we'll say, sensitive knees or fragile knees, maybe you want to just pop your butt onto a chair or onto a couch or a step stool, something that gets you in a seated position. But the rest of us are going to be doing tall kneeling, or low kneeling cat camel. Excuse me, I'm all over the place today. I can't really read. I'm blinded by this light in my face. Low kneeling is here. You're seated back on your heels. Tall kneeling would be up here. So we're going to be in a low kneeling position. We're going to do cats and camels. We're going to protract our shoulder blades, protract, and we're going to retract our shoulder blades, all while extending and flexing our thoracic spine, because we know that rotation, which we're about to do, is actually just a combination of flexion on one side of the spine and extension on the other. That's what causes rotation. So we need to own and have great thoracic flexion and extension, where we have something like 50 degrees of flexion and I think 25 degrees of extension. So we need to utilize every last little bit of those flexion and extension moments so we can get some more rotation in a minute. Now to do this, a lot of people are used to the cats and camels, and if you want to, you can do your regular cats and camels. That's fine by me. Do your thing. But for the rest of us, we're going to sit back on our heels, and I'm going to reach forward with my arms, but flex my spine. I feel a huge stretch between my shoulder blades. And then I'm going to puff my chest out and pinch my shoulder blades back, and head goes up. We're going for 8 of these in each direction. So there's 1. Breathing out. And in. And out. In. I've already lost track of how many I've done. I think it's 3. We got 3 more to go. Breathing out. And in. That one always feels good. Okay. Moving on to seated trunk rotations, and then an isometric end range hold after that. So what you're going to be doing, I don't know the yoga name for this, but I know in a few yoga classes I've been to, we always do something similar to this. One knee bent, one knee straight, and one hand behind you. And so I've got my left knee up. I'm going to take my right hand and go over the top of that thigh and pry myself over. I'm then going to switch my feet, switch my body. Keep your chest up nice and tall. We're going to make 5 rotations to each side. You are breathing out as you're rotating. Remember, we don't want to hold our breath while we do this because we want to get as much range of motion out of it. If we hold our breath, we're just filling these two pillars of air in our body. It's not going to allow us to go as far as we can. So I would actually challenge you to say, okay, hold your breath and rotate, and then let that breath out and try to rotate more. I can pretty much guarantee you're going to get more as you breathe out. And I think this is 4, and we're doing 5 on each side. Turn your head with it. All right. That's 5. Now, what we're going to do, we're only going to do rotation to one side. So I'm going to keep my right leg going because that was the last one I left off with. And what I'm going to do, I'm going to have to sit tall here. And I'm going to try to get as much rotation as I can. And then I'm going to take my arms away and see if I can't maintain that range of motion. So just like the shoulder stuff we were doing, I'm going to take that stretch away, or the assistance, and see if I can hold it. Maybe I lose my range of motion, maybe I don't. But the goal is to hold as much range of motion as I can, which is an end range isometrics. It gives me ownership, and it reminds my joints that this range of motion exists, and it's okay. So maybe I do these, and then I can go out and golf a little bit more comfortably because I'm going to be able to make a better turn in my thoracic spine than butting up against my stiff joints and then trying to compensate with my low back. So this can be good for low back health. Maybe I'll throw it in on next Monday, but probably not. So we're going to rotate, pull yourself as far as you can go, get really stiff through your trunk, and then take your arms away. And then pull a little more, and then take your arms away. And then the back here, I'll show you from the side. So I'm rotating, tall through my chest, and I'm not losing any of that range of motion. I'm making great rotation to my right, able to hold it, using my obliques, using my lats, all the muscles between my shoulder blades. And we got one more to go. That last one was okay, but I did hold my breath a little bit. Try not to. Try to really exchange air as you hold it for about 2 to 3 seconds. All right. Other side. Okay, so same deal. Get yourself as far as you possibly can. Pull yourself into that end range. Step through your trunk. Breathe. 2, 3, and relax. Tall. 2, 3. Pull into more range of motion if you got it. Tall through your chest. And let go. 1, 2, 3. We've got 2 more to go. 1, 2, 3. And then we're cooling off a little bit with a stretch and then some planking and we're done. 1, 2, 3. We got 1 more to go. You can definitely do this seated in a chair. It's a little bit more taxing on your trunk if you're having to keep yourself upright in that seated position on the floor. Oh man, I'm gonna grab a sip of water. Air conditioning is fixed in here, but for some reason I am just warm. Maybe it's because I'm doing this in pants, I don't know. All right, so we've got a half kneeling tricep stretch because we're gonna be doing tricep push-ups here. We want to stretch out that underside of our arm so we can better get our arms up without having to shrug. Because if this is the range of motion you get before hitting your mobility limitation in your lat and your tricep, the only way to get your arm higher is by shrugging and kind of faking it. So we're going to stretch that muscle out. You're going to get into a half kneeling position. It's kind of like stretching out your hip flexors. Go from the side, you can tuck your toes under and back, get a little bit of big toe mobility. Huge fan of that big toe mobility, by the way. If you haven't already, you should check out the bunion and plantar fasciitis 3-minute clinics I threw up last week. I think big toe mobility makes its way into both of those because it is pretty crucial. So my right knee is down, my right arm is going over my head, my left arm is going to grab it, and already I'm feeling a little bit of stretch under here. But I know I can do a little bit more, so I'm going to go into a side bend. And side bend is amazing through a thoracic spine because once again, we're flexing one side of our spine, extending the other, And that is great for rotation. So now I feel a huge stretch all the way down through my hip into my quad. If I want to, I can even rotate forward a little bit to get a little bit more lat, which can also restrict my ability to put my arm above my head because it crosses through my shoulder joint. We're here for another 20 seconds or so. Then we're moving on to the other side and planks. Breathing, stretching should be something you want to do again. It shouldn't be the hardest thing you do in your day. It shouldn't be something you fear. It shouldn't hurt. It should feel good because the whole point is to take the threat away from your nervous system so we can say, oh, that's a cool, great, awesome range of motion. I love that. You should do it more often. And if you're sitting there, you're panic breathing, and you're like, oh, I can't get through this. It hurts too much. Guess what? You're doing it too much. You need to back off a little bit. Work within your limits. Try to surpass those limits, you're not going to get where you want to go. You want to have it nice and comfortable, arm up, pulling over. There we go. This has a little less tight on me. Got those right shoulder issues lately. I think it's because of quarantine. I haven't really been able to do as many pull-ups as I used to. I think I'm not getting all that stretching from the bottom hang of the pull-up. We're here just a couple more seconds. About 30 more seconds or so. Then we're going to incorporate trunk stability, shoulder stability, scapular mobility, and elbow mobility. We've got all these things coming together with a real simple but not easy baby plank with tricep push-up. Who knew? All right, so we got about 5 seconds left. All right, awesome. So, stretched out our arms, we feel like Gumby now. You can just move them around. Maybe you want to just call it a day and just keep it relaxed and not finish with these planks. For the rest of us, we want to incorporate this last little bit of movement into our practice today, into our shoulder health, which our triceps, our chest, deltoids are so important for. We're going to do a baby plank. If you haven't done these with me already, you're going to say, what the hell is a baby plank? And a baby plank is just a plank on your knees, pretty much. But if you have kids, or if you've been around kids and spend some time and see the way that they develop and they move, a big way they develop shoulder stability is with one of these planks. And that's actually why it's called a baby plank. I'm not saying you're a baby if you do these, because let me tell you, I'm probably about to shake like a leaf, because they're not easy. So what you're going to do, you're going to lay down on your stomach. You're going to put your elbows underneath your shoulders. You're going to put your hands flat on the floor because we're going to be pushing through here. If you have wrist issues, you're probably just going to want to stick with the plank. What we're going to do is we're going to get up into one baby plank, and then you're going to do 8 push-ups, and we're done. So I'll talk you through the baby plank. I'll come back down, and then we'll redo it all together. Sound good? Sounds good. So your feet are going to be pointed. You can't see my feet, but I'm pointing my toes and I'm putting them down. I'm not tucking my toes under. I'm slouching through my shoulder blades because I then want to say, oh, what do I have to do to undo it? I need to push away from the floor. So I'm activating my serratus anterior, a little bit of my rotator cuff, and my lats. From here, I'm going to lift my belly button off the floor. Maybe it's already off the floor. Good for you. And then I'm going to lift my pubic bone or my pelvis off, and then I'm up on my knees. And from here, I'm breathing. This is a baby plank. And so I'm breathing. I'm shaking like a leaf here, so these push-ups are going to be brutal. And then I'm coming down. So we're going to go through that setup, and then as we go through that setup, we're then going to push at the end of the baby plank. When we're at the top, we're going to be doing some tricep push-ups, okay? Only 8 of them. So we're going to be slouched, undo it to get all that great shoulder stability. Hands are flat, belly button's up, hips are up. Now we're going up and down for 1. Keeping your shoulders out of your ears. 3, 4, 5, 6, 2 more, 7, 8. We did it!